The two main tendons on the top of the foot are called the extensor tendons. These are broke down to the extensor hallucis longus, which comes along here, has its own separate tendon. You can actually see it here quite well on this particular foot. You can see that line there. And if you move your toe upwards, pull your toe upwards, there you go, you can see a nice tendon appearing there. So that's the extensor hallucis longus. The other tendon will come down here, and then it separates and spreads out and goes in between each one of these toes. So it comes down, goes over the top of these. You can almost see some of them there. There's actually a line there, and a line there. And if you lift your toes up, there you go. You can see them really well on this particular foot. So that's the extensor digitorum longus. And all of those tendons lift the toes upwards. So if you're thinking, if there's some pain on the top of the foot, sure, it could be the bones. Sure, maybe it's one of the nerves, not so likely, but one of the most likely things could be one of the tendons, the extensor tendons. If you lift the toes up there, or you lift the toe up here, you can test for that and see if that produces one of the pains. The next set of tendons are the perineal tendons. So the perineal tendons come from the perineal muscles on the side of the leg, and they come down here. You can actually see these tendons pretty well here. It's like right there on the outside. It comes down here, and then they wrap underneath here, come down, insert the peroneus brevis, inserts at the base of the styloid process there. Peroneus longus comes down and wraps underneath the cuboid there, and then comes under the foot and attaches there. But their job is to pull the foot outwards. So if we get our patient to push their foot against my hand, you'll see, there you go, peroneus brevis really noticeable right there. And then if they point their foot downwards and to the side, the peroneus longus then should be activated more so. So if you have problems around this area, it could be the perineal tendons, and that's sort of where you would check for them. The tibant tendon originates from the tibialis anterior muscle, which is on the anterior part of the shin. If you feel the tibia bone along the front and then move just to the side, you'll feel this belly of muscle. And then if you follow that down, it'll take you down along a tendon which inserts along this part of the foot. Now, if we want to get this one to show really nicely, we can ask the patient to pull their foot upwards quite hard. There you go. And then you can see that tendon really nicely along there. This one helps pull the foot upwards. So if you have any pain along the inside of here or along here, it could be the tibialis anterior muscle or the tendon. This is a common one to become inactivated if you have a foot drop. Sometimes this tendon is overused, is if the foot is collapsing all the time during function and the arch is rolling down a lot. Sometimes this tendon will overwork to try and counteract that flattening by pulling the arch up. The next tendon is the posterior tibial tendon, which is on the back of the foot and on the inside. And the final tendon of the foot is the posterior tibial tendon. This tendon runs along the back of the ankle around here, comes along here, wraps underneath here, comes along and inserts at the navicular tuberosity, which is just here. And its job is to pull this way to invert the foot in this kind of way. If our patient inverts the foot slightly, there you go, you can see that tendon quite nicely just there, pointing upwards. And try again, push down and in. There you go, there you go. See that tendon nicely. This tendon can be affected along the tendon, along here, but more commonly where it inserts into the navicular bone just here. We'll often see this type of pathology in patients that have flexible flat feet and are constantly walking with their foot flattening out, and it pulls along this area and causes a lot of pain. It can become very severe and problematic and degenerate over a long period of time if it's not treated.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.